बोलो स्टार्ट।
Hello, everyone. Welcome back to the next episode of Aditya Birla Health Insurance's Health from Home Beacon Specials. After a brief period, India's COVID case trajectory is on the upward spiral again. The second wave, which has hit India, is causing a wide surge of infections. A lot of people we know, from Bollywood celebrities to our next door neighbors, are testing positive today. But really, what is more worrying is that the pandemic is now affecting a lot of younger people and children too in the recent times. This has led to many parents fear about their children's health and safety. So for today's Health from Home session, we have with us Dr. Nihar Parekh, the founder of Cheers Childcare, a pediatric healthcare center which is helping kids for over last 12 years. It is the first in the country to start the concept of a well child, which includes a structured approach to complete medical, physical, and behavioral development of a child from birth to 15 years of age. A very good morning to you, Dr. Parekh. Glad to have you here with us.
Good morning, Jeffrey. Pleasure's all mine.
So Dr. Parekh today will talk to us about the recent scare parents are going through regarding their child's well-being. To all our viewers today, if you have any questions regarding your child's health, do drop those in the comment section and we'll have Dr. Parekh address your concerns shortly. So Doctor, a recent report confirmed that over 79,000 children in India have tested positive, and this is since March, as we grapple with the second wave of the virus. This number alone has been reported by the 5 most affected states. What do you think is leading to the surge in the number of cases amongst children?
Jeffrey, in our experience, when the COVID first began last year, we very confidently and through our own personal experiences tell every parent that don't worry, although you guys are suffering, I know, hang in there, but your kids are safe, because genuinely, we were not seeing that many cases. We were hardly maybe seeing a few a month, which were also suspicious and didn't require any intervention, 0 admissions, no symptoms or anything related to COVID. But all of a sudden, since a month and a half, we've seen a blast of pediatric cases in our clinic, COVID cases, to the extent we've reached a point where we say that if the child is coming with fever, lasting for a day or two, with any other associated symptom of cough, cold, loose motion, skin rash, body ache, headache, or even just fever without any associated symptoms, we would think of it as COVID unless proven otherwise. Now, my goal of telling you guys this or on this platform is not to scare anybody. It's just to make everyone aware that it's there, it's rampant, and it's not a myth where people, and we strongly used to believe that kids cannot affect COVID. Yes, COVID is affecting the children. Now, why did this happen? There are 2 possible reasons. It's a little bit of a controversy. One, according to me, is when in December, Jan, parents realize that kids are pretty safe, kids are doing okay, they're not getting affected. They took that additional little bit of liberty of sending them back to the classes, football, tennis, swimming pools were shut, but traveling, playing as simple as playing in the compound. I used to know of parents, kids, and I don't blame the parents at all. It's extremely frustrating, taking care of children who are 4 and 5 and 6 and keeping them at home. They're a bundle of energy to kind of control that kind of energy at home and constrain it is so difficult. So they let loose, and rightly so, because they were going cuckoo. They didn't know they had other things to take care of. Send them down to the compound. All the kids started mingling, and it is impossible for a child in his or her excitement to keep the mask on while playing, to interact with other children with masks on. The first thing they do is when they go to the compound, they take their masks off, and rightly so. So the stepping down, going for play dates, going out of town with other friends and families and kids. In general, the relaxation, without that fear in mind and with that confidence in mind that, look, kids are okay, we can wear our masks, but let the kids enjoy, kind of led to that. The second theory is there, and a lot our government and is still contemplating on this theory, there has been a mutation. The mutation of the strain of the virus. There have been two mutations. The virus that has now started spreading, it's either a UK variant, the mutation which has been seen in London, or the second mutation which has been seen in Brazil or in South Africa. Now, even these mutations, which were seen first time 2 months ago, had started in London, Brazil, South Africa, had seen a huge number of pediatric cases. So there is a theory that that mutated virus may be amongst us now, and which is capable of affecting children. So I think these are the two probable theories that we bank
But in these cases, what do you think one can do to protect their child from contracting the virus? So yes, like you mentioned, children are going out, they're a bundle of energy, they like playing. It's also difficult on them. So considering that, how can a parent really protect their child from contracting the virus?
on. So I'm going to answer this in two phases. Phase one is what I'm going to try and pinpoint the need of the hour, of the exact current situation as of today. And phase two of my answer will be what will happen when things get better. So, right now, for the answer of phase one and the way it is exploding in children, is I would request every parent out there who has a 1 year old, a 2 year old, a toddler, a little 7, 8 year old running around everywhere, a teenager, 10, 12, 15. For the next 10 days, try and not step out at all, because the next 10 days is going to help break the chain. Stop going for everything which is an option. Stop going down for everything which can be avoided. Yes, I'm not saying if your child is sick or you are sick, do not go to the doctor. That's the first thing you should do. But going down to play, having those social agendas for the next 10 days, I would sincerely request every parent to try and help break the chain of spread, at least amongst the children. As of now, we know that children do get the virus, but from our experience over the last 2 months, we know it's not that bad for them. We know they don't need hospitalization. We know they recover on their own. They do well. Very few of them require exponential tests and CT scans and saturation monitoring. And we know that all is not required. But that is what we know as of now. We do not know what will happen to these children 1 month later if they carry on getting such infections. We cannot predict that. Nobody could predict what would happen in adults in the first strain. We can't predict what can happen in children in the second strain or the second wave. We are seeing the rise of cases. We are seeing them recover completely. I want the parents to be rest assured that their children, even if they get the virus, they should not worry. They should not panic. Their kids will be fine. Their children will be absolutely with them all the time. They will not be taken away for isolation. Very rarely do we need the child who is sick enough to be put on a drip at the clinic, but we still avoid hospitalization, and very aggressive investigations are also not required. And phase two is once things calm down, sanitation, hygiene is extremely important. Mask at all times should be the norm of the day. Kids under 2 years of age cannot wear masks. We don't recommend masks because sometimes it leads to suffocation, difficulty in breathing for them. But above 2 years, if you can start training your child on daily basis to keep the mask on, don't create fear in them, but explain them, talk to them. They will understand what is going to make things worse for them or is better for them. So phase one, keep every child indoor for 10 days. And phase two, when things open up, don't go out celebrating. Take it step by step. Go slow. Analyze every step. Do the classes which are only absolutely the need of the hour. Step down for half an hour. Make sure they're not all children together at one time. Try and insist on masks. Try and insist that play being guided by parents so someone can monitor at all times. What happens is all the parents in the building send their kids down together, go play 5 to 7, 8 to 6. There's no parent there, obviously, because they need their time up at home. But all the kids are just hugging and kissing and and they're being children. Technically, you can't blame them for doing that. So always, if there is a parent around, who, is always there to try and keep a little bit of distance between them, try and insist on their mask covering their nose and their face at all times. These things have to be kept in mind. So that's your phase two.
So I think safety is the key. We can't let loose and we have to be more careful, especially during the second phase now.
Correct.
But doctor, what if a parent gets test positive? How can they ensure that the child is safe? Because you're in the same house and child can't stay really away from the parents.
So this is a question which is the most commonly asked question we get right now, or used to get even when COVID started, when the parents were really, getting infected. So there are norms. Now it all depends on how old your child is. If your child is self-reliant and is capable of taking care of himself or herself, maybe they put it around about 8 to 10 years of age, you explain them the situation and ask them to stay away from the parent as much as possible, the infected parent. Now, what we always advise all parents is, even though there are no cases currently in the house, make a structured approach to what if there is the father getting infected, there is a mother getting infected, or the entire house gets infected. So the protocol suggests that if the child needs to be with the mother, a breastfeeding child, a clingy infant, a small toddler, they should be with the mother, even though she's infected. But the symptoms of the mother should be less, or the mother should be asymptomatic, meaning a mild fever, headache, body ache. She can handle the toddler, she can handle the infant with masks at all times. She can even breastfeed a newborn baby with a mask at all times, even though she's infected. But she has to be, again, I repeat myself, either mildly symptomatic or asymptomatic. If she's breathless, severe body ache, coughing away, then the next best thing is to hand over the child's complete responsibility to the lesser affected or non-infected parent who can take care of the child. Now, if breastfeeding mothers do get really severely infected, we ask them to stop breastfeeding, because then social and isolation is a must, because kids do get infected. Again, breastfeeding is the key in a newborn. So if you're a breastfeeding mother, you have tested positive, but you are mildly symptomatic, wear a mask and breastfeed. If you're severely infected and severely symptomatic, do not breastfeed, but you can still express your milk and ask the father to give that milk in the bottle. Third, if the child is a little older, he can or she can be handled by the father. If the entire house, many a times you see, I'm infected, my father is infected, my grandparents are infected, then let the child be taken care by the least infected or symptomatic parent. We would still not recommend grandparents to handle children, either they're infected or not, because the consequences of the disease in people who are 55 and 60, we have seen a lot of complications and a significant percentage of them requiring hospitalization. So we would ask them to be, kind of least involved in taking care of anything to do with the children, because even though the children may be asymptomatic and parents don't test the children, they can be carriers. So you don't want the child infecting the elder parents.
Yeah.
Between the mother and the father, let the child be taken care of by the parent who's less symptomatic or negative.
Yeah, I think that's important, and we need to be very careful, especially with our own parents also. So, doctor,
Correct.
in case a child has contracted the virus, what are the medicines that could be given to the child in that case?
Okay, I'm going to be very candid. Uh, as of now, if your child has fever, there is a very high percentage that the child has contracted the virus. Now, the protocol we follow is, most of these viruses, most of the COVID infected children, their fever goes away in 2 days. So, our protocol is, whenever we get a call, Doc, my child has a fever. So the main first thing is, how much is the fever? Less than 100 by definition is not fever. Many a times parents put their hands on the child and say he's burning hot, but when he's taken on the thermometer, it's less than 100. So don't panic and call that a fever. Keep a nice simple thermometer at home. Once the fever crosses 100, You have your simple paracetamols, can be administered. Fever medicines can be administered every 4 to 5 hours to keep the fever down for a period of up to 2 days. If the fever crosses 2 days, you need to go see your doctor. That doctor will assess the child, look for signs of other viral infections, look for signs of other causes of fever, rule out the other causes of fever, and start appropriate medications, maybe a basic antibiotic. The commonest antibiotic we've seen that helps treat children with COVID, actually antibiotics are not required, they're not recommended. But in such a case of COVID where nobody knows exactly what's working and what's not, what we try and do is what we know from our experience, from the amount of what we call is evidence-based medicine. We see certain molecules of antibiotics like azithromycin and all have worked well and helped children in recovering faster. So we do start those. The minute blood work is done on the second day and we get an indication that the counts are low, the platelets are low, the CRP is high, we've ruled out other causes of fever like a urine infection, no malaria, no dengue. In our minds and hearts, we are pretty convinced that the child has COVID. And we explain the parent that, look, your child has COVID. You have to isolate the child. Start all the norms that we discussed. Keep the child away from everyone who's more than 55 to 60 at home. If the child is more than 10 years of age, you can help isolate the child. If the child is small, one of the parents can take sole responsibility of a child in a room and do everything whatever is required. We start the medications, and 99% of the cases of children, they recover in 3 to 5 days without any other requirement. That additional 5% who go into persistent vomiting, persistent fever, get dehydration, get loose motions, get a bad cough, we sometimes call them over to a clinic for quick drips for a few hours a day, for a few days, and they are okay. But the golden question is, should we test the child? Now, this is a decision we entirely leave on the family. The family has to take a call, because our simple instruction is, if your child has fever as of now, and we've seen the child on the second day, and we know that it's got the symptoms of COVID and all other causes of fever has been ruled out, please consider it as COVID. Take it as COVID. Treat the child like he has COVID with certain isolation and hygiene norms and follow the strict ruling. Some parents say, okay, you know what, doc, whether we test or no, you tell us it's COVID, we will take it as COVID and follow the norms. Some parents say, no, my grandparents are insisting, we live in joint families, we want to know. Sure, go ahead and test. And most of those tests are coming positive.
Yeah, I think we all need to be extra careful and do take tests a little seriously. Any home remedies do you think that we could take along with the prescribed medications?
You know what, there is one is the actual medication, which involves symptomatic medications, which are fever medicines for fever, vomiting medications for vomiting, stomachache medications, antispasmodics for stomach aches, and probiotics for your loose motions, and cough syrups for your cough. The next genre of medicines is what we call as vitamins or immunity enhancing vitamins. The only 3 vitamins that have known to reduce the symptoms or help in recovery during a COVID, or mildly protect the child from getting severe symptoms, are zinc, are vitamin D, zinc, vitamin D, and basically your vitamin C. These are 3 things that have undergone enough research to determine that they do have a role to play in reducing the symptoms and the suffering of the child. So your pediatrician, your family physician will prescribe you the adequate doses for children of zinc, vitamin C, and vitamin D. You also have to not get carried away in prevention. I know parents who've been given vitamin C, vitamin D, and zinc to children for 2 years, 1.5 years since the day COVID started. We've had few cases of hypervitaminosis D and C, means an adverse effect of excessive vitamin D given to the child just to prevent sickness, which has led to high calcium levels, small stones in the kidney. So you have to be very careful. Don't read off the internet, don't talk to your friends. Even to prevent, even multivitamins are basically drugs. So you have to consult your pediatrician for the proper dosage. When it comes to home remedies, my only kind of calling is keep a well-rounded diet for your child. Make sure the child is internally fit. Your good diets, your healthy diets, which cover all your all your nutritive groups of carbs and proteins and minerals and vitamins. Keep a well-rounded diet so the child eats well. Keep a very high hygiene value. Teach the children to wash their hands before and after they eat, cover their mouths when they sneeze, wear masks at all times when they step out of the house, how to use and how much to use a sanitizer, sanitation, because kids, I think they've forgotten everything. And I see kids roaming around with small bottles of sanitizer wherever they go, which can be a little risky because it does contain a dangerous kind of alcohol if consumed orally. So these are things that you have to insist. All home remedies I'm in favor of. All home remedies, you call honey, ginger. There were so many powders in between that came.
What's a child's favorite that you've heard of?
I would say, any vitamin C that has that little tangy, orange juicy, those kind of certain tablets that you effervescent tablets you put in water and they bubble up, and they love a sort of a fine looking, fun looking, good colored and good tasty drink. So any vitamins which are, because that's a very good question. Palatable vitamins in kids it's a huge thing. It's very difficult to find out what kids like, what taste. So I've been actually strongly recommending a lot of pharmaceutical companies that don't work on creating the perfect taste of a medicine. Work on creating a tasteless medicine. Because if it's tasteless, you can outsmart the kid by mixing it into anything and giving it. Because they are so smart and they are so sharp that once they decide they don't like a taste of a particular vitamin, even if you mix it in the smallest proportion, in the biggest of the meals, they're going to refuse taking that meal ever again. So I've been requesting all pharma companies, make vitamins, make medicines which do not have a taste, because these kids are too smart.
Yeah, I agree. And they are very, very fixated also in terms of what
Correct.
they want, what they don't want.
Correct.
So, doctor, now we also know that there is vaccine available. So, is it safe for a child to get the vaccination?
So, when it comes to
vaccination,
so currently, vaccines for children are under trial. All the vaccines which are out right now across the world have been tried only and are being recommended only in kids or children above 16 years of age. In our country, the drive is going to reach, I think, people about 25, maybe next week, in next 2 weeks, are going to be allowed to take the shot. And then they will go for between 16 and 25. So the latest information is that Pfizer, which BioNTech, the company which made the vaccine to start with, is currently in stage 3 clinical trials of pediatric immunization between 12 and 15 years of age. And they have seen phenomenal results where even a strong vaccine like a Pfizer could only generate 90 to 92% efficiency in adults, has touched 100% in children. So the vaccine trials, and extremely safe, even more safe in adults. So the safety value is high, the protective value is 100%. So they are having phenomenal results in the last stage of clinical trial for kids between 12 and 15. Now, once that is done, Moderna and all are already starting for lower school age groups between 6 and 11. They're also looking to include newborns and 6-month-olds and 8-month-olds, but that is still in stage 1. So as far as we can kind of predict what Pfizer and BioNTech are looking to do is try and have healthy, safe immunization for all children from 6 to 8 years and above by the beginning of the academic school year of 2022. So it will still take time.
Yeah. One more year to go.
Yes.
So, doctor, since a lot of children are today getting are testing positive, how can a parent take care of the child during this time? How do they engage with them to ensure they stay positive during that period?
I'm very happy you brought this up because over the last 6 months, we've seen a lot of children coming in with their parents as frustrated as the children because of the homestay, because of the kind of restriction in physical act. See, kids are extremely energetic. They need to channelize their physical, mental, emotional energy in one direction. And the best way to do that is physical activity, to run around, to play around, to do some sport, some physical contact with other children. But once that stops, all that pent up emotional energy gets converted to mood swings, gets converted to hitting, screaming, shouting, biting. And it's not easy on parents as well who are staying home. Even we ourselves are not used to being home all the time and work from home. We need that social interaction at work. We need that social interaction with friends. So as much as I would like the parents to kind of approach their children in a different way, I have a soft corner for the parents as well. So as the parents try and calm themselves down, relax, get themselves in a right state of mind, then and only then will they able to be in a state to deal with their children. Because if a parent is shaken up and not very sorted with this current situation, their capacity to handle the child who is also having a tough time is going to be very difficult. So once a parent kind of finds the right, what we call as the mixture, to keep the calm mind and the same mind and not panic and get the job done, take care of the house, they need to then focus on the child who also is having similar, the routine's been upside down. There's no stepping out. The school is online, which they've never seen anything like this before.
Yeah.
So they need to keep, see, about 6 and 8 years of age, the parents can talk to the children. They need to sit down with the child every few days and say, okay, look what's bothering. How can we make it better? What interactive play would you like me to do with you so that you don't feel this way? Kids nowadays are very expressive. It's about how open the parents are to sit down and talk to their child and ask them what is bothering them. Kids under 6 years of age, you cannot talk to. You cannot expect them to communicate exactly what's bothering them. So you have to predict. You have to know your child. You have to try different things and see what calms the child down. But what I feel most in children above 6 and 7, the parents have to befriend their children. Sit down with them. It's a very hard time for them. It is emotionally hard. It is physically hard. They're getting lazy. They're getting consumed by the screen. They're getting consumed by their kind of vices of excessive junk eating. And parents, if they don't put a stop to that and say, right now everything's okay, it's going to turn out to be a habit. So when things open up also, they will refuse to go down. They will refuse to get off the screen. They will refuse to ask for that pizza 3 times a week. So the parents need to put a foot down. But I think the best way to are a open all lines of communication. Don't hold anything back. Kids are also very perceptive. You are troubled, you open up to them, they will also open up to you. And this is specifically if you have children more than 8 years of age. For children under 6 and 8 years of age, spend one-on-one time, try and experiment with a lot of different activities and find that kind of soft spot which calms them down, which they really look forward to doing every day, and what is not detrimental to their health.
Doctor, like you said, of course, it's difficult on a child, and I would say it's equally difficult on a parent to deal with it because we're all going through uh, these unprecedented times, something that has happened to all of us for the first time. And it's
Correct.
also very tough for a parent to see their child go through this phase. So both emotionally and physically, it is very exhausting for them. What would be your
Correct.
piece of advice for the parents? How to deal with it? What is it that they could do to stay
Correct.
positive themselves and also let the home environment be positive?
Correct. So what we've realized is over time, most important thing is have a fixed routine for you and your child. You have to have a routine that starts from the time you and your child wake up till the time your child sleeps. Even for you, it's important because it's structured. Unstructured approach to day-to-day living is the biggest cause of depression when you know things are not in your control. So when you have a structure to your daily routine, there is a sense of control. There is a sense of completion when you finish one activity and go to the next one. When you finish one chore and you go to the next one, that sense of accomplishment was highly undervalued when we were stepping out and doing our day-to-day things. But right now, that sense of achievement is what is giving our self-confidence a boost on daily basis. And look, you know what? I have it in me to wake up at 7 every day. I have it in me to do that 40 hours of 40 minutes of exercise every day. I have it in me to eat only 1.5 chapati and not 6 chapatis every day. So those sense of small senses of accomplishments is what that is going to keep those happy hormones of self-confidence and achievement and trying to get bigger and bigger goals and help you survive through this. Once you are in that positive mindset, that is the same positive mindset and the same sort of a structure you need to try and inculcate in your children so that they feel good. Reward them when they follow that structure. Reward them when they do 20 minutes of some exercise with you. Reward them with a little bit of a screen time. Reward them with their favorite meal. So there's a sense of accomplishment built on day-to-day basis, and you're not looking for that bigger goals as of now, which you have no choice but to put it on hold temporarily. Yeah. So if this positive day-to-day living keeps kind of spreading, it kind of spreads as a positive mood in the house. So everybody follows it. It's contagious. If you are happy, the person next to you gets happy. If you are sad, you're just going to bring the whole family down. So this is what, and my last thing is, please do not shy away from taking help from experts like counselors, taking help from experts like child psychologists when it comes to your children, because everything you cannot be an expert at and everything you can't Google or find help online. There are people trained for years to help you out with this, and there is no shame in such unprecedented times to kind of get an online consult with your doctor, figure out what's going on, and kind of snip all the problems in the bud before they raise to a point where you need medication.
Yeah. And doctor, what if an expecting mother gets tested positive for COVID? Does this pose any danger for the child?
So it depends when she gets tested positive, which trimester, first, second, or third. First and second, you just have to watch, hope, and pray the disease doesn't grow to a level where it kind of affects all the systems. You have to understand COVID is not a lung disease. COVID is not, the virus doesn't affect that just one particular lung that we think is where it's going to attack. It affects all the blood vessels of the body. The extent of the disease, what we call as a multi-inflammatory systemic disorder, can reach every part of your body. Point being that in a pregnant mother, if this kind of a severe infection reaches the uterus, yes, it can lead to premature deliveries. If it is a mild COVID in the first or second trimester, we've seen pretty uneventful pregnancies through. If the mother gets COVID positive during the delivery or delivers within a COVID positive state, we test the baby immediately, a newborn baby with a swab, to see if the baby is positive or negative. If positive, we usually monitor the baby for up to 3 weeks to 3 months to look for symptoms in, kind of a newborn. But so far, we've never seen COVID play havoc in pregnant mothers. And the babies are also being delivered just fine.
That's really nice to hear that, because I think that's a very critical phase for any new parent.
Correct.
The child, because they just come and they see the world for the first time.
So Jabji, what happens is, I'll tell you a little kind of a scenario that doctors are going through. Nobody knows anything about the disease. We're all learning. It was never expected. It was extremely unprecedented. There were no research papers, nothing. So our research started the day the disease started, if you can technically call it that, a year and a half ago. So we are still also in the learning process. We try and get articles. We have a lot of common platforms from all doctors across the world. We've been all tied together to see who's learning what. So even if you read the news or seen the news over the last 1 year, HCQS has worked, azithromycin has worked, deworming medicines, ivermectin, nothing is still confirmed. Nothing we know that hits the nail on the head and says you give this and the virus will die. If you give remdesivir, the virus, no. It is all out of in our experience, is what we've seen, is what we've tried and what we realized works better than this. Again, there are some studies that say that it doesn't work. So it's just luck that it worked and the patient came out. So putting two and two together right now for us is very difficult. So we are also learning on day-to-day basis, and we are using every ounce of our experience, every ounce of our gut feel over years that we've accumulated, and every ounce of our networking to talk to every possible doctor in the world to see what's best and how we can prevent, treat, and save lives.
Yeah. And I would say we can't thank doctors enough for being there and helping us sail through this pandemic.
Yeah, we're just
On
trying
that,
our best.
on that note, Doctor, thank you so much for joining us today and helping us find answers to the various concerns that we have related to our children. We're all grappling with the second wave, and I'm sure we'll come out of it strong.
Yes, we shall. Yes, we shall. God bless.
Thank you so much.
Take care. Bye-bye. Bye.